Good morning, Dr. Sterling Ray. Thanks for joining me today.
Definitely. Good morning, sir.
Why don't we start by telling the viewers who you are and what you do? And I noticed you're having breakfast, so sorry for interrupting your breakfast.
No worries. Sterling Ray, Chief Medical Officer for HCA Houston, Kingwood.
Okay. And how long have you been there?
Started in September of last year, so roughly 8 months or so.
Okay. Well, thanks for joining us today. I wanted to talk about your challenges as a CMO on a personal level and a professional level when it comes to managing the hospital with the COVID-19 pandemic. And, you know, Kingwood is a fairly large hospital. And it services or it has lots of lines of services.
Yeah.
So with respect to this pandemic, you're kind of the best of two worlds. You know what it's like to be in the ICU with something like this, and at the same time, being a leader. I don't know if anything prepares us for this when dealing with pandemics. Maybe the disaster drills, but on a short period of time. You know, we've had hurricanes and stuff. So far, what have been your three top challenges, if you will, in managing the hospital?
Yeah, I think some of the challenges, there are many, but the three biggest ones would probably be staying abreast of the changing landscape for the pandemic. Every endemic area is different. Obviously, Wuhan, China was the epicenter, and then as things started to spread, and more domestically, we had Washington, we had New York, we had New Orleans. And now here in Houston, our experience is very different from those that I previously mentioned. So I think staying abreast of the changing landscape, understanding what lessons learned, what trial and error applies to your current situation, and what may be de novo, what may be something that's unique to your situation that you need to prepare for. Also, the changing science around understanding the COVID infection, the evolving science around laboratory testing, the evolving data around how patients present and how a lot of patients can show up with routine medical conditions that we're very comfortable treating, but then have underlying COVID that could be obvious or not. How do we manage in those circumstances? So I think that's one of the biggest challenges. Secondly, I think really managing supplies and making sure that everyone's adherent to protocols. Obviously, we're rationing, our PPE and being very judicious. And when we use our PPE, I think it may have blacked out a little bit. But obviously, just in how we disperse our PPE, the circumstances, how we keep our environment safe, how we make sure everyone is compliant with those protocols. Because there's a lot of perceptions amongst our medical colleagues as to what is protective and how do you manage that deviation amongst our colleagues, because at the end of the day, there has to be a standardized norm that everyone upholds, because that speaks to how we can be good stewards of our limited resources. And I think the last thing the most challenging thing is obviously managing fears. I think it's really unprecedented for what we're dealing with right now. And when I see the level of anxiety and fear and how that alters the more objective sensibilities that people have at multiple levels, from administrators all the way to senior clinicians, to new clinicians, residents, and then ancillary staff, there's a variety of different comfort levels. And I think being able to speak to all those different comfort levels and situations is probably my third biggest challenge. But I welcome it and appreciate being in a position to allay concerns.
These are amazing insights. I mean, I want to thank you first because I work there, and I know without your leadership and you taking care of all of these things, I wouldn't be able to work with the PPEs and so on and so forth. And yes, I've seen the same thing as far as fear is concerned. That's most of what I see, anxiety from the people frontline. And what about the hospital itself, with revenue being down and everything not having steady flow income, whatever, however the hospital makes its money. That must be also challenging to kind of manage all of this. In dealing with personnel, what have you seen that now comes to the surface more so than anything else, whether it's the fear and anxiety from COVID, or I'm not going to have a job, or is the hospital going to close, or, you know, what are some of those things that you're seeing the most from people?
Yeah, that's interesting. I've had a lot of time to reflect upon that. I think with the shelter in place, the social distancing, the governor's decrees that have closed businesses, it fits in the observation we have now within the hospital where our volumes are low. Mm-hmm. Everyone that would normally historically come to the hospital for a variety of different reasons are clearly not coming. Mm-hmm. And our census got below 50% of its annual run rate as the pandemic started to spread. We're slowly starting to creep up, but in the census increasing, we're seeing actually much higher acuity, which to me suggests that individuals that would normally come in with chronic comorbidities earlier in symptom onset are waiting. And so we're seeing the more advanced strokes and the heart failure and the cardiac cases and things of that nature, even advanced pneumonias that aren't COVID related. People obviously are a little reluctant to come into the hospital, and we're seeing them when they're much more acute.
Well, I can speak, I know that we're very appreciative, and you mentioned family. How's that impacting you and your family?
Everyone's doing well. Surprisingly, no one's ill in my immediate or extended family. Everyone is sheltering in place. And I think just the boredom of the social distancing is getting to everyone. But we're just evolving. This is going to be our new norm. But overall, things are going well. I'm fortunate to have a wife that can stay at home. So with our homeschooling and things of that nature, it makes it a lot easier. And but very blessed and thankful that everything family-wise is going extremely well.
Good. One last thing before I want to thank you again for taking the time. You know that a big topic I always talk about is burnout. What have you seen, and I know you're also very passionate about it, have you seen any impact from COVID-19 on burnout as far as the physicians or your nurses? Have you seen an increase, decrease? Have you seen people's attitudes change, put it on the back burner for now because something else is more urgent? What have you noticed as far as the rate and presentation of burnout, if you've noticed any change?
Well, surprisingly, I think how laser focused everyone has been on COVID, that's been a unifying theme amongst all of us, and we share the pain. It's dispersed. I think when you look at burnout, it's each individual's own, circumstances that they internalize that might be different from others that affect them differently. And I guess there's some shared therapy in having a similar goal that everyone is focused on. I think it just helps us to decompress a little bit. So I really haven't seen a higher rate of burnout that I perceived among staff. I think everyone is ultimately wanting to get back to some semblance of normalcy. I think they are a little burned out with the topic of COVID. Mm-hmm. And I think now that at least from a preparedness standpoint, we have everything in place that we need to put in place. It's not perfect. And now with the comfort of knowing that our interventions are established and we know what the protocols are, we have our systems in place. I think that's allowed for some anxiety and concerns to reduce. Yeah. But I think where there is some anxiety right now is mostly in how every individuals are going to manage with their home life, and then what will things look like in the hospital moving forward. As we always have to keep in the back of our mind COVID while we get back to the bread and butter mechanics. My CEO says a lot that we have essentially two jobs now. One is managing COVID, and then our previous job. Yeah. And I think creating that balance as things ramp up in what was our norm before COVID, I think we'll see new dynamics of burnout. But for right now, I think the laser focus on COVID and that shared reality of all being united is therapeutic. But so I really haven't seen any increases in burnout per se. We're just all united in a common push.
That's a very interesting observation that, we're all under the same, like you said, united in misery, if you will, or the same threat. So now we're laser focused, we're less internalizing, and just everybody's on the same wavelength. And we look at each other and say, okay, you understand my pain, you understand my pain. And so it is therapeutic, which is one of the things we talk about when we talk about burnout, is share your pain, discuss it out to the open. Well, now we have, maybe this will teach us for later on after COVID is done. It's like, hey, you know what? This worked over here. Why don't we try it over there? Dr. A, I want to thank you so much. I know you're very busy. You're having breakfast and you're between two meetings. So thanks again for having us. I will be posting this on our website. I will send you the link when we do so. And if you have any questions, you know where to find me. And I will get back to you for hopefully more insights. Again, thank you so much. I appreciate it.
Thank you, sir. Appreciate it. Glad to be of help. Take care.
Bye.
Be safe. Bye-bye.
Bye.